us are afraid of digital pathology and not replace us, but I think it's really good to augment how we practice, make us more efficient, and allow us to make better diagnoses, interact with the eye. And then once it becomes standard of care, then everybody's going to be forced to do it, better patient care, ultimately. That's kind of a ways out, but I think that's another potential driver for converting to digital pathology, be it a small, large group, or hospital system.
Welcome, my digital pathology trailblazers. Today, my guest is Dr. Todd Randolph, and Todd is a pathologist who is living the dream remote pathologist lifestyle. I just hosted a webinar, and I had several people commenting, hey, how can I work digitally? So Todd is actually doing this, and if he wanted, he probably could work with the tablet on the beach or in the mountains. I just saw mountains through his window. Could we not all work like that? We are both smiling now because there's a bit of a catch to this. It did not happen overnight. In contrary, it took quite some years to get there, and not only pathology experience, but also business experience and some heavy digital pathology trailblazing to enjoy this way of practicing pathology. So with that short intro, I welcome you, Todd, Dr. Todd Randolph, to the show. How are you today?
I'm good. How are you, Alex?
I'm good. I'm excited to have you on the show.
Yeah, no, thanks for the invite. It's great to be here.
Let's start with you. I
of course.
I want you to tell the digital pathology trailblazers who you are and what's your background, and also what did you do before you started practicing 100% digitally?
So, like most pathologists in the mid '90s era, I joined a group. Which was relatively small initially, where I practiced primarily surgical pathology, anatomic pathology, with a little bit of CP. I'm APCP boarded. And then I was, that group grew significantly. That became almost a 20-person group over a 20-year span. And I was active in that group, developed some specialization. We subspecialized in the late 90s, early 2000s, so I began to specialize in GU.
Where this specialization in pathology, is this like a new thing? No, right?
Not really, yeah. But in that era, it was a bit. I don't think they actually had a GU fellowship
okay.
in the late 90s.
I'm asking because it's totally not the case for the rest of the world. You don't have such strictly specialized pathologists, but here in the US, I was like always exposed to, I do skin, I do dermatopathology, I do GI, I do soft tissue. And I'm like, what about the rest? And I was, and I kind of took it for granted that this is the level of specialization all over the place. It's not. And now you're saying that it actually, not all the specialties were available in the 90s. Cool. Thank you for that.
Yeah, as far as the, fellowship, specific training for them weren't available, and it was driven. We can go off topic for a second. It was driven a lot by the healthcare system. The large healthcare system began to have subspecialty conferences as opposed to just a general tumor board, which is kind of the classic thing where a pathologist presents. So they began to subspecialize into chest, and then soft tissue, and neuro, and GU, which is the one that I did. So that kind of drove our practice to begin some specialization within the group. But we still all of us practice general pathology as well, but all the referral cases and things like that, preparing for the conferences, would go to this particular person. So that's kind of where the subspecialization, quote unquote, began to arise in our setting. And I assume other larger practices with large medical systems are probably similar to that, have similar experiences. But so anyway, so back on track. So yeah, for 20 years, and obviously after doing something, relatively consistently, kind of the same way over 20 years, I was beginning to look for at least a different career path, or maybe a way to practice the same type of tissue, type of pathology, but differently, practice it differently. So I began to kind of look for that, maybe you're 17 or 18 or so, and then stumbled upon an opportunity in around 2016, where I was able to kind of make the leap, right, to industry, and I did it kind of in parallel. I began to work for a biotech company as their medical director, so much more on the clinical pathology side, and then also and this kind of goes back to how your introduction, happened to be lucky enough to be in Utah at that point in time. And that was the very early days of Lumea. And I'm not sure how much your audience knows about Lumea and Matt Levitt.
You can say like how it enabled you. I don't think I had anybody from Lumea on the podcast to strictly talk about the company. So feel free to explain like how this enabled you.
Okay, yeah, sure. So it was Matt Levitt's idea.
I had him, but
you had Matt on. Okay.
Yeah, I had Matt on the podcast, but he was talking about different things, including Lumea.
Gotcha. So Matt was essentially the founder of Lumea as well, and his idea was to digitize pathology. Right. He saw the need for pathology to become a little more efficient, how it was practiced, and then also I think well ahead of his time, where artificial intelligence would ultimately be introduced.
I'm laughing because in the podcast he's telling the story, and I'm gonna link to this podcast. He's telling the story where he decided, he's gonna go digital. He bought a scanner, and it was so slow.
Yes,
that it was just such a mistake at that time.
So it was rather clumsy initially, like all things new are, right? But I had met him, and then when my situation changed, when I left my group where I practiced for nearly 20 years, started with the biotech company. Then I started to work with him, with Lumea. So that was kind of the early days, very early days in Lumea, where they still had a laboratory. And Lumea, like I said, was a company where Matt's idea was to digitize pathology, right? So that was my initial experience, and I worked fairly closely with Lumea in the early days, and then was still doing the biotech, and then kind of back and forth through that process, and then started signing out digitally with him probably like 2017, 2018. And once Lumea was, to scale, it was fast enough, as you alluded to, and organized enough. And I was primarily almost exclusively doing prostates at that point in time. Their system at that point was really optimized.
Were you not missing other pathology?
Not at that point. No, I wasn't actually. Yeah. And we could go into that. I think as we talk about digital pathology in general, I still have a number of colleagues, right, that are on the platform with whom I interact. So it is a different interaction, but I think you could certainly do a hybrid model of digital pathology and on-site pathology as well. Kind of get the benefits of both worlds, but that's kind of where your personality was or where your practice was. So ultimately, the biotech medical director position kind of changed a bit. I'm still affiliated with that company, but not as much. And the digital opportunities expanded, probably right before COVID.
On the diagnostic side.
2020, yeah. So that's where I kind of made the decision. All right, I'm going to veer more toward the digital pathology, and it was, using the resources, as you mentioned before. It can be kind of capital intensive, right? Initially, where Lumea had that initially, and then that's a whole other story. What's happening with Lumea, and how the practice of pathology kind of moved beyond that.
Matt kind of goes through the story a little bit, because he he started Lumea, then he started practicing pathology, but then Lumea was more software, and then
Yes.
there was some kind of conflict of interest, so he stepped out, started a pathology practice, then again he stepped out, and so he
Yeah.
has an
Yeah.
interesting
Yeah.
journey.
So that's kind of where I am now. When
Mhm.
Matt said he stepped out, that's kind of where Lumea became and is basically a technology company, and they have a digital platform that is very efficient, very optimized for digital pathology, called Biopsy Link. So that's what I use, and that's the company, the practice that moved outside of Lumea is called PathNet, and I contract out with them to read digitally, to read remotely. So
But
that's
you have
one.
your own practice, right?
And then there is another practice.
Because it cannot be too simple. That would be just too
Yeah.
straightforward.
Exactly. So there's another practice, primarily GI specimens. That's unrelated to the spinoff of Lumea, where they have self-standing laboratory scanner on site, but we are using the Biopsy Link or Lumea's software, Lumea's structure system. So that's the one where I have most experience, as opposed to having a separate viewer and an LIS where you have to kind of go potentially in between. Biopsy Link has them both together. So it's a long, long introduction, but that's kind of where I am now, and that's kind of my daily practice is covering.
So, like, legally, do you have your own pathology practice, or are you like self-employed? How do you practice?
So I'm set up since I'm strictly a contractor, I'm set up as a 1099.
Okay, so you're a contractor pathologist for several companies that enable their pathologists to read digitally.
Yes, exactly.
And we were both smiling during the introduction because you currently are living what many would consider the dream life for pathologists, with the ability to work remotely, sign out cases from home, and maintain a flexible schedule. Can you describe what a typical day looks like for you in this role, and also how it compares to your role before, when you had to be on site, like to do a little bit compare contrast classical on site versus fully digital right now?
Right. So the digital is kind of, like you said, it does give you more flexibility than what you typically have with an 8 to 5 type position. So my typical day would be, just kind of getting started on cases, right? Kind of signing in, logging in to a dashboard similar to what you would have with a regular laboratory information system, and then I would just work through the cases for that day. But you can take breaks if you need to, run errands if you need to. So it does give you that flexibility, provided the internet's working that day. And it's fast enough that day too. That is one of the limitations.
So is this a cloud-based system, or is it something that you like have to pre-download ahead of time?
Yeah, no, it's cloud-based. Yeah, it's cloud-based.
Okay. There are different versions. I'm just asking out of curiosity.
Right. Yeah. So it's
And
cloud-based.
another like logistical questions: do you do primary diagnosis or do you do second opinions?
Both.
Or both. Okay.
Yeah. Mostly primary, right? Yeah, mostly primary diagnoses. So yeah, I mean that contrast, without, like you said, there is one element where you don't have interaction with colleagues, at least direct interaction with colleagues, but there are several other pathologists who are on the platform, who work within the same companies that I work, who are either employees or contractors, who I've met, in person, live. So I know that we develop, social relationships, and essentially, I can either call them on my cell phone and say, hey, take a look at this case. I can shoot them a text with the case number, and then I can share the case with them. We can talk about it. So it's as if you're sitting across the scope with them or at a multi-headed scope, but it's just all virtual. So that's different, right? As opposed to having a conversation with somebody.
Do you like it better or worse? Like, what are your feelings about this way of interacting?
No, I think it depends on the personality of the pathologist. As far as the technical quality of the image, looking through a microscope versus looking through looking on a monitor or a screen or whatever, the images are equivalent. The digital is at least, if not better, than what you would typically get underneath the microscope. So in that regards, I think it just depends upon what you're most comfortable with, what you like as far as the personal interaction. One advantage of having a digital platform is that you have, tremendous expertise available where you wouldn't necessarily have that to that degree in a hospital setting. I mean, like I said, you may be the only dermatopathologist, but you would like the opinion of another dermatopathologist, and if there is another dermatopathologist,
and you're the only one in the hospital.
Yeah, you're the only one, but you could ask somebody else to look at the image. So in that regards, I guess the digital is superior. But you're not going to lunch with a colleague, right? You don't have that interaction to figure out, how was your day or what's coming up, or I have this challenging case to talk about. You're not interacting with the clinicians as certainly as probably as frequently as what you would in a hospital setting. The variety of practice is probably less with what I'm doing because of the nature of my current practice, where I'm so specialized, at least primarily. So that would be maybe quite a bit of difference between that and a general practice. I don't go to tumor boards, for example, anymore. I don't have call, but yet there's a little take that it's there's cases are always available. So it's hard to kind of turn it off.
Okay.
That's what I found as a challenge, right? That's different. Whereas if you're in a work setting, you tend to leave whenever in the late afternoon or early evening, and you go to your home, wherever your next place is, and you stop. You have to stop because you don't have the
you have
equipment.
like not only a mental but also a physical transition, and that kind of helps you switch tasks better. Whereas, I know for my just the digital content creation activities that I'm doing, this is constantly available on my phone, and I get messages about things, and I try to respond to people because I know that they have questions that they need answers to. It doesn't mean that I have to do it right there and then, but because I can, I do it, and maybe I should not do it all the time.
And that probably comes with the territory of anybody who works remotely, right?
Yeah, I guess it's like a new era, new digital age challenge that you have to navigate your mental health in a different way.
Exactly. Exactly. So that for sure is a difference between historical pathology and digital, primarily remote pathology. Yeah.
So from your perspective now, I think like a lot of things that are not available digital, like you say, variety of cases, it kind of comes with specialization. I don't think it would be different if you were on site and you would still be like in this specialist capacity.
Right. Exactly right.
For me, the digital consultation, they are so much like less intrusive than it felt when I was starting, and I had to like go with a slide to a colleague who was doing something under microscope, was busy when they're in their work. I was like very early in my career, so everything was looking funky, and I'm like, is it embarrassing to go with this? Let me like go through everything and then collect stuff. But then you have a pile of slides, and you also don't want to take a chunk of time of people. And now what I tend to do, I mean, I've seen more slides since I started, so there is a little bit of the experience component, but also the digital accessibility of colleagues. You don't have to bother the same colleague that's next door all the time.
Right. Yeah. No, that's good.
And they
That's a
can
good point.
also answer on their own time,
Right.
rather than me like interrupting and knocking
Interrupting
on the door.
and
So
demanding at that point. So it does
I
give them an
actually
opportunity
like
to
that.
triage a little bit. Yeah. Yeah. That makes
Mhm.
sense. So I think those are I think we covered the major points as far as
Yeah, I
the
think
difference
so too.
between historical on-site versus I think and your point about if you were especially in more of a academic setting, the type of tissues specimens would not be different that much different from what I'm currently
Mhm.
doing primarily. Albeit I still see some general pathology in a different setting, but certainly not as much as what I did my first 20 years of practicing. Yeah.
So obviously, it took some time before you uh, got to practicing like that. So is there anything that you think, oh, would not serve you when you were a younger pathologist, if this was a possibility? And we're going to talk about like what hurdles you had to go through and how you arranged this digital world for yourself. But do you think that there is a disadvantage for people entering the pathology profession to start digitally?
I, I think in general there probably would be a little bit of a disadvantage to be 100% digital starting out, and I think that's would be again dependent upon the personality of the pathologist, the colleagues, and the comfort level that you have showing cases, learning from them, and there's probably a fair amount that actually you do pick up with just casual conversations about a case
Mm-hmm.
that you may not have if you just get a result back from somebody after looking at it digitally. If you're sitting across the scope with them, uh, I guess think about when you're both sitting there and then you're looking at a slide, or looking at through the lens or the oculars, and then you look up and you chat about something,
Mm-hmm.
and you would probably lose that if you were just sharing cases digitally,
Like through
right?
a system.
And not in real time, kind of like you said. I could send it to them and they could triage and look at it when they would like, and they get the answer back to me. But you lose that casual conversation, that learning experience. I don't think digital pathology lends itself to that type of interaction, which is critical in the early days, as you mentioned, when showing things around, building your confidence. So I think in that regards, that would be maybe a bit of a disadvantage to start out doing that. And then I think you need those general skills as well. I guess it depends upon where your career path is, but I think to be able to do frozen sections, right, and present it to the boards and things like that, if you really want to be able to participate in that type of setting. But if you always see yourself as being, I'm just going to be a person working off site, so specialized, that's all I'm going to do, then I don't know if that's the best idea starting out. But that's kind of where right now I think digital pathology is in that regard. So that's kind of a lengthy answer to your question, but yeah, I think there are disadvantages to strictly at least starting your career digitally. Yeah, or at least 100%.
I think it is like you kind of lose and I mean, to everything that you said, I kind of agree, and I also disagree, because the environment that you have, like studying in med school, vet school, doing your residency with your colleagues, basically when you go remote, this disappears. And if you thrive in this environment, and this is environment kind of on purpose designed in a way to stimulate learning and stimulate learning from each other, not only from the lectures, right? So this disappeared. Can you recreate this digitally? I think you can, but will you be able to take advantage of this digitally as well as people in the normal setting? Depends on the personality, and probably you might need to put some more effort into that if this is important to you. I think like through osmosis, with people, it's going to be faster and easier. Um, it's still possible digitally, but you need to put effort. You need to like, we do, where I work, we do digital rounds. And I basically like communicate and send screenshots without like a formal way of requesting second opinion, just to colleagues I trust and I know already from on site. So it's not like fully digital strange people that I never met. I was on site before and then I moved to digital. But yeah,
Right.
so you've been practicing digital pathology full time since 2018, which actually makes you a true pioneer and a digital pathology trailblazer, because I kind of think like the tipping point was during COVID, which was
Right.
you've been doing this for 2 years already. So do you have some insights of those early days working digitally? And what were the challenges? How did you face the transition to a remote setup? And like, what did you do to have a good quality of work? And let me just tell you one thing that I remember from my early days in digital pathology, which was like 2016, where I needed to do annotations on slides. And the act of annotating this tumor would take me like 5 seconds. The image would take 30 seconds to open. I was going crazy.
Right. Right.
I was
Yeah.
like, oh my goodness, as much as I believe in this technology, please, I cannot do anything in 30 seconds. Like, I cannot use
Right.
this time.
Right.
And the
Right.
task only takes 5 seconds.
Yeah. So I think the initial challenges, obviously bandwidth is important. I mentioned a little bit that earlier. So you have to have, and then not only, where you're located, but also the I guess the
Yeah,
upload
they
capability of the
send you the
laboratory
images.
where that's originating, right? So that there may have been some bumps in the road for that time it was Lumea, because they had a laboratory within the Lumea organization, but that was pretty well ironed out between that 2016 to 2018 period of time. For them, at least, they worked through that process. So for me, the latency wasn't, usually isn't that big of a deal. And I don't remember it being a big issue when I first started as well. So I think, just some of the challenges with it was a new laboratory information system. So I think that's kind of where you would potentially run into. There were some, obviously bugs along the way because it was a new system.
Like with any
It's much better
software.
now than what it was initially. But yeah, I think those are probably the major things. It wasn't things had pretty well been ironed out by the time I started, but I think I started, try to really force it back. Kind of when we said Matt had the first scanner, right, and had our values been as high as what they are now, then it really would have been a challenge. But I think the values and things have basically increased as the technology has improved and allowed that volume to increase along the way.
Yeah, and there are different systems. You can either have systems that are like cloud native and everything happens in the cloud is like really directly dependent on your bandwidth in the moment. Regardless like how you optimize viewing those images, like Google Maps or whatever, that not all the tiles are loading. And there are
Right.
systems where you have to download stuff ahead of time, which also have their challenges. I think the size and the data transfer is still like, it's not as bad, but it's not as seamless as I would like it to be.
I see. Yeah. 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 And you don't have personal experience using the Lumea biopsy system.
No.
Yeah. Okay. Be interesting to see what you would think of that, since you've used other
I
systems. Yeah.
am planning. I actually was talking to them, and maybe I'm gonna go to the conference later in the year, to the Lumea, to the digital
Oh, the one in
diagnostics
Park City
conference.
in the
Yes,
fall.
yes,
Yeah. Yeah.
that
Great.
one.
Yeah.
So
You
if
should.
anybody is going there, let me know on LinkedIn. I might be there as well. So,
Cool.
digital pathology obviously offers a level of flexibility that's quite unique in the medical field. I think only the image-based specialties can actually benefit from that. The radiologists, they're a little bit ahead of us, and now pathologists. So, did this impact your work-life balance? Um, like, what do I refer to? Like, would you design your life the way you have it regardless, or did digital pathology actually enable this? And I kind of am asking this from a personal perspective. My husband is a clinical pathologist, and at some point he also switched to the industry because he wanted to try something different and live a different life. And this kind of directly translated into a different work-life balance. You kind of had it with the biotech, I assume. But now you have digital pathology. Were you missing digital pathology? Like, how did it influence your lifestyle?
Yeah, good question. So I think it did enable a relocation for me. Initially, like I said, my practice was kind of tethered to a large hospital practice, where I was active with call, active with tumor boards and presentations and some administrative. So it required for me to be at least within a reasonable commuting distance to those facilities, right? Whereas now, that's not a requirement. So it does give a pathologist a little more flexibility. You don't have to be within, close to the laboratory, or as close to the laboratory as what you would initially, or historically. So in that regards, it has enabled me to kind of relocate into a setting that is a little more interesting to me, that allows me to pursue my outside of pathology interest.
What do you do outside of pathology?
I enjoy the outdoors, so I do a lot of well, not as much as what I would like, but the plan is to also do a lot of outdoor activities, hiking, biking, primarily Nordic skiing and things like that. That's what I enjoy doing, in the mountains, preferably. So we lived in the mountains
the beautiful
initially.
mountains out of your window.
Yeah, we're a little more rural there. Yeah.
So you kind of say digital pathology enabled you to live the life a little bit more the way you want. Do you think, because it wasn't like, oh, you just raised your hand and you could do digital pathology. You have a unique employment situation. You're a contractor pathologist, and it's not that all the hospitals out there are looking for contractor pathologists. You needed to build, to establish connections, build relationship. And so I am hearing voices from the pathology world that people would like to be able to work like that. So is there any advice that you would give pathologists who would like to do a similar thing?
Right. Yeah. I think on your, like I said, on your own would be challenging. And for me, it was just, the stars kind of lined up, at least early on, meeting Matt, working with Maya, and establishing that comfort level, and having a laboratory that was focused on digital pathology, right? Which kind of enabled me to do that. And if you were starting on your own, I kind of see it as, two different ways that would work. You would certainly need to join with other people to try to create, whatever that mass is that's required. But if you're already practicing as a group with maybe a larger healthcare system, the advantage of digital pathology would be lifestyle and potentially recruiting, as there are fewer pathologists out there. But there would have to be one thing too that we always struggled with in my group. We had centralized laboratory, and and it was difficult to transport glass slides to the remote, further out locations, right? You were always dependent on the courier as far as when you would get your case. So you complained about, having 30 seconds to load, but sometimes you would be waiting hours for cases. So if you could, convince the administration or maybe do a joint venture where you would digitize maybe the majority of those slides and not have to rely on couriers, have better turnaround times, and that way you would share with that infrastructure cost, that requirement for digital pathology, and allow you, as part of the group, more of a traditional practice, right, where you might be able to do a hybrid situation where you would do some work remotely, either in the facility, or you could be in a smaller hospital and then do the rest in a different location the second part of your day, or have that flexibility when or where you would practice. So that would be one way to do that, to introduce digital pathology. I think another way, if you're a little more entrepreneurial, would be, like I said, you could set up a subspecialty group or approach a subspecialty clinical practice and kind of, I guess, go with kind of a joint venture. If you're more interested in a large multi-specialty clinic or something like that, where they would say, hey, you can establish a laboratory, and I can be one of your pathologists or your pathologist, something like that, and this is how we can work together. And if one group isn't big enough, then you might be able to find a couple groups to work together. But that would be you as a pathologist kind of driving that concept, right? And it would be kind of taking that opportunity back from maybe some of the larger commercial laboratories that you may have, I certainly saw that in my career, where you tend to lost that. But now, that opportunity may be changing back to local pathologist where you can compete at a digital level, because you would have access to that clinic and say, hey, let's work together to try to build that practice. So that would be one way. And then I think another way would be to, like I said, the advantage of digital pathology is that it gives you access to experts. So if you were to, with a group of pathologists, kind of say, okay, let's try to set up a slide processing facility, a scanning facility. Centrally, it's going to take some capital. We can bring in clients and offer, subspecialty service from bringing in specimens from a variety of locations, and then we're offering that service, and we may be working with several dermatopathologists that may not be that close by, but yet we can offer a tremendous service, again, competing with some of the commercial labs that maybe you couldn't do that before because you couldn't have people on site. You don't have enough work in one spot. But if you centralize it, then you do have enough work if you digitize it. So those would be kind of the three ways that none of them are particularly easy. I think there are benefits for if you go with the model of it's just pathologists setting this up, or I'm working with my clinician colleagues in their multi-specialty clinic, or as my large health system, hey, these are advantages of going digital for all of us. So did that answer your question? I think that's kind of how I would think.
Yes.
Yeah.
And you emphasize a very important point. None of them will be easy. All of them are going to be pathologist driven. It's like, you kind of like had this type of career, and it kind of tells me, well, you have to make this type of career for yourself. And, maybe you're lucky and you can join an institution that already is digitized, which is fantastic, but less than 10% are, or probably even less than that. And then it's like figuring out, trying to find an anchor. I kind of had a similar, I don't know if it's a similar story, but basically also very much like actively driven by me. The first job that I had in the digital pathology space, maybe we can call it by accident. It was, I went to the interview and they needed a pathologist to oversee image analysis efforts in the company. It was an image analysis company, and I joined the company and I started liking this. But this
Right.
experience and me liking it did not really result in me just like being able to raise my hand and say, hey, take me to this other startup or take me to this digital thing. Actually, when I started the blog and the podcast and I incorporated the Digital Pathology Place as a company, and that was a time in my career where I didn't know if I will ever have anything to do with digital pathology. I was switching totally to preclinical veterinary pathology work. I was lucky to join a group that was already interested in this technology, but I didn't know if I will have anything to do with it. And I still wanted to anchor myself in this environment. So I just started publishing online about it. And that led to different conversations, different relationships.
Yes.
And
Yes.
if I wanted to stay in this field right now, it probably would be easier for me with what I have already experienced and done in this space than somebody who is just starting and asking, hey, where can I do digital? And I try to like let people know, hey, this is a company that wants a digital pathologist. This is another one, but with just such a fraction of institutions being digital at the moment, and then even another fraction of this actively recruiting for this kind of a role, it's still kind of a niche way and a marginal way of practicing pathology. As
Right.
much as I love it, and you with your
I think we're
path
still there.
are showing that it took you some effort to be able to do
Right.
that, and some
Right.
affinity towards this that was
Yes.
not really driven by, oh, I want to have a nice lifestyle.
Yeah.
And there
Exactly.
was it kind
No.
of came
Right.
after
Right.
that.
And I think one thing that maybe we have, I mean, you mentioned, image analysis, and we haven't really talked about,
Yeah, I
artificial
wanted to ask you at some
intelligence.
point, but I didn't want to interrupt you. Do you do AI for on the biopsy
Right.
work?
Yeah. So I have some experience, kind of limited experience with several algorithms, primarily, well, I think exclusively at this point in time, prostates with prostate pathology, and I think there's two ways to look at that. One is, again, we're in the early days of what that looks like, and I think the company with whom I'm contracting is trying to establish, the benefits of the current version of those algorithms, and I think there will be some benefit, or there is benefit in using that. But I think as that technology matures, and I think it will mature, and the efficiencies that you will, I think, realize as a pathologist, as a practicing pathologist, using that as the numbers of pathologists decrease, right? We hear that time and time again. And then also, the potential diagnostic algorithms where the AI sees, quote unquote, sees more than what we currently see as pathologists, and how we as a pathologist, or I as a pathologist, work along with AI to potentially render a better diagnosis, right? An improved diagnosis from what I currently can do, be it, historical glass slides with light images versus digitally. Once we establish that, and I think that will be established, then you'll have a driver because that'll become, the standard of practice, having to use digital, because I think a lot of us are afraid of digital pathology. It'll not replace us, but I think it's really going to augment how we practice, make us more efficient, and allow us to make better diagnoses, interact with the AI. And then once it becomes, quote unquote, standard of care, then everybody's going to be forced to do it, right? Be it a small system or a large system, hospital system, whatever, because it'll be better patient care ultimately. That's kind of a ways out, but I think that's another potential driver for converting to digital pathology, be it a small or large group or hospital system or whatever. I think that'll happen. I don't know if I'll still be practicing at that point, but I'm 90. It just depends how quickly things mature. But I can see that as being a driver for adaptation. Yeah, to digital path, based on my experience. Yeah,
Very much. You mentioned standard of care when this like becomes so clearly better. I want to say
right.
and
Just an enabler. Yeah, right. Yeah, for sure.
like clearly a lot better because now we are like in the space and for the prostate AI. So specifically, this is an algorithm that points out the malignant areas in the
Right.
prostate
Typically,
gland,
that's
right?
what the yeah,
So
exactly.
it's basically this is like um, it highlights where to look. So then you just look there, and if it is there, it's there. If it's not, then you might look somewhere else. Um, but we're still in this like increased efficiency, maybe increased accuracy, but like how much increased, and when does it start to matter for the decision makers to decide that this is the way to go?
Right.
So yeah, I guess so when you say when there's going to be something in addition to this efficiency and increased accuracy, what do you think about? Do you have something specific in mind? Like do you think of like predicting molecular
Yes,
properties?
exactly. Something
Mm-hmm.
that might augment molecular. I don't think it's going to replace it by any means, but
Mm-hmm.
if there's a way, um,
To speed up to the
either through quantitation of tumor content or particular histology to recognize kind of what we do with ERPR, right, and HER2
mm-hmm.
now. Is there a different way to think about therapies based on what the AI may see and what we may confirm as pathologists, that we don't know of yet, right? I mean, and essentially that's kind of discovery and learning, right? And
Mm-hmm.
using algorithms and looking at clinical outcomes and what would be different. And so that's a lot of fun stuff. I think there are probably companies out there that are doing it.
That only do
I don't think
that.
that's a pipe dream. I think that's there, right? Based on what I've seen
Yes, I
and
think
heard
it's
about.
there.
So.
Mm, but then when you say AI is there and we're going to do AI in pathology, it kind of I don't know, I have noticed that this is like a trigger statement where people are, what do you mean AI is
Mm-hmm.
there? Because when you say AI is there, we both now understand, because we just had this conversation, we mean this particular algorithm that highlights this type of cells in a prostate biopsy or in a
Right.
prostate resection, right? uh, and in the like context of this conversation, this is what AI for us means, and yeah, it's there. I mean, people use it. There are practices that use
Right.
it, right?
Right. Right.
But this is like a narrow, uh, very narrow application out of so many narrow applications. So my like impression or my feeling about it is, it's like with all the medical devices. It's going to be one medical device at a time, one algorithm at a time. Although there are efforts to like building models that can detect multiple cancer types in multiple organs. I don't think we're that far away from this. I would need to do some more reading up on this, but um, it kind of contradicts to the blanket statement AI is there, which is the case, but it's this narrow application of AI. And I think without the context, what it actually is, have I seen it? How comfortable do I feel with it?
Mm-hmm.
Uh, like, is it actually helping me or not? Without this context, um, it is more polarizing than it should be. I don't know what's your impression about that.
If it's a tool that the pathologist can ultimately, all that you have to be a pathologist to use it correctly. and we improve patient care, patient outcomes with that interpretation tool, then it's an advantage for us, right? As a profession, as well as for the patient. So it's a win-win for everybody. Like you said, the applications now are very narrow, but I think it will become more broad.
You mean more broad in terms of there's going to be more narrow applications, or more broad in terms there's going to be like one thing that detects every
I think narrow applications, you're right. I would think, is there
you can like chain them and tools that are more powerful.
Yeah, exactly.
I think so too.
Our right now are all tubular adenomas alike, kind of in our minds. Maybe they are, but maybe there's something that's there that with the assistance of AI, we might say, oh yeah, I see that, I agree with that, or I don't agree with that. Is that likely to recur, or is there something there in this one that's not there? That's probably too much for our minds, or at least my mind, to process as a pathologist on a case-by-case basis. But if something's there, processing that image differently, looking at it, looking at it differently, and then I'm there kind of orchestrating all that information. That would be fun, right? That'd be a blast to try to
it would be amazing. But there also needs to be, like you say, it's too much for my mind. It's totally too much for my mind as well. The research that is out there is mind-blowing, but I cannot personally verify, hey, is it good or not? So I think like I very much appreciate the regulatory oversight over this. And you know what I learned recently? That there are a lot of AI tools. So you don't need an FDA clearance for any of these devices or algorithms to actually be used in a lab if you do your CLIA validation in a lab. But to me, it was like there is some kind of regulatory approval or regulatory framework that you need to work within, or at least you should have had a publication. It is not the case. I recently saw a publication like Public Evidence of AI. I'm going to link to this publication in the show notes as well. But basically a publication analyzing how many AI tools are out there. And it was over 100 tools all over the world. I learned that the restrictions in Europe, now the regulation changed, but the IVD framework did not really require an external authority to review this validation data. And then there are a lot of AI tools that have been approved by a regulatory body before any data was published on the validation of this, or some that are not approved or were approved without any validation. I was kind of a little bit shocked, and that kind of put my mind on alert. I was kind of looking through the FDA clearance framework. This is not the case for everyone creating AI tools for healthcare. So I guess it's like some food for thought for all of us.
Yeah, no, I think exactly. I think once they are used, I'm assuming that they will be used for either, to facilitate primary diagnosis or to affect patient outcomes, as opposed to just a research R&D type application. Then you'll need some type of certifying body, be that for us, the CAP or CLIA or something like that would happen, or for, if it's actually affecting patient outcome pharmaceuticals, then you might get into like an FDA type level or something like that. But I think that would be, that's kind of like the clinical validation of something, as opposed to just a analytical validation.
Exactly. So that's what I meant, that not all of them have undergone the clinical validation as opposed to the analytical.
And what that validation needs to look like, who sets those guidelines and guardrails for all that. That will for sure have to happen. And that'd be a cool career, right, for somebody to go into that, to kind of pioneer that and work through that. And I think that's probably where some academics are working on that. might be hard for that to come from the clinical commercial world. But I think those career types will probably be driven from an academic setting.
Mm-hmm.
But no, I agree with you.
Yeah. So before we leave here, before we finish this episode, I don't want people who are interested in this field and who wanna work remotely, who wanna do digital pathology in one form or another, to walk away and say, "Hey, they both have started doing it already before, and they have plenty of connections, and like, what am I supposed to do?" So, like, my advice is always like, start learning about it, and there are different avenues of learning. I chose the like online online informational content, including the content that comes from various digital pathology companies and commercial entities, and that are spreading the word about their development. So that's kind of like what I always recommend, and then you start seeing opportunities that you didn't know actually were opportunities before you started being interested in this. Do you have any words of wisdom for people who are interested, but there's not that many digital open positions yet?
Yeah. I don't know if I have anything to add to that. I think as we said earlier, and you alluded to the point, it's probably going to be driven from you as a pathologist, but just to learn, what technical skills, technical understanding do you need to have? We didn't really talk about scanners or imaging, connections, interfaces, and things like that. Do you need to bring that to the table, or at least understand that before you have a conversation with hospital administration, for example, or for you to go out and potentially think about doing it with a group of with another group of pathologists or a subgroup of pathologists. If you want to be the driver for that, then there probably is some technical, and I'm probably not the person to ask for that, because I was lucky enough not to have to do that. But I think to your point,
I consider myself lucky as well, but there's always luck, and there's always the preparation part, or like the what do you then have to back up this luck.
Right.
So definitely listen to this podcast, because if I'm going to be hearing about anything, I'm going to be letting you know. I want this technology to spread for the good of humanity, and patients and pathologists. I definitely drank the Kool-Aid, but that's okay. I think it's a good technology. Thank you so much, Todd, for joining me today.
Welcome. You're welcome. You're welcome. Nice meeting you and spending more time with you again.
You have a wonderful day.
Okay, take care. Bye-bye.
Thank you for staying till the end. This means you are a real digital pathology trailblazer. And you know what? Don't get discouraged. Like in any discipline, like pathology is niche, and then digital pathology is really like a fraction of pathology, but it doesn't mean that we're not supposed to look for opportunities in this area. So as I said in the podcast, my advice is always get informed. And so if you did not grab the book yet, please do. I'm going to leave the link in the description below. This is going to give you an amazing intro to digital pathology, and you take it from there wherever you want to take it. And I talk to you in the next episode.